I'm Dr. Michael Rose. I'm a plastic and reconstructive surgeon at the Institute for Advanced Reconstruction. Sternal nonunion happens when after typically a heart surgery where the cardiac surgeon has cut the breastbone in half to get access to the heart and other structures inside the chest, that bone does not knit or heal back together again. Just like any other bone in your body, the bone can heal or not heal. And then if it doesn't heal, that's called sternal nonunion. And the result is that the sternal bone moves around and it's very uncomfortable for the patient when they breathe, cough, and do certain activities. It could be as simple as just rolling out of bed can be painful, or trying to do sports like golf can be extremely painful, and everything in between. A typical sternal nonunion patient notices movement, clicking, rubbing of the bones of the breastbone inside their chest. They can also have shortness of breath and pain, and sometimes the clicking noise is loud enough that it actually disturbs somebody next to them, typically their spouse or significant other lying in bed with them, when they roll over and they hear a click, and it can be very disconcerting. So unfortunately, unlike other bones, such as an arm bone that can be sometimes treated non-operatively by putting a cast on it, there's no way to put a cast on your chest. You must keep breathing, and therefore your bones are constantly moving. So the only really viable option to repair sternal nonunion is surgery. And what that entails is opening back up the incision that was made by the cardiac surgeon, and then bringing the bone together and putting plates and screws across the nonunion to bring the bone together stably so it can heal. Even though your chest continues to breathe, this area is held stable and the breathing happens in the ribs just like normal. I think anybody who has had heart surgery and is having persistent pain in their chest and gets the feeling that there's instability there is probably a candidate for me to talk to them and see if the surgery is right for them. In a small percentage of cases, people aren't terribly distressed by the nonunion. They might hear a little click, but it doesn't bother them terribly much, and we can avoid surgery then. But if it causes you distress and you can't do your typical activities and the things that you want to get back to, well, then I think the surgery is right for you. So we typically do these surgeries in the hospital with a one-day stay over. The day of surgery, usually you'll get there a few hours before, and then you'll go in for your surgery after we've made sure that we're all set for the surgery. The surgery is relatively quick. It takes me between an hour and a half in most cases. And most people, when they wake up, they actually feel better. So if we're going in there for the right reasons, because you have pain and it probably hurts all the time because you're breathing all the time, you're going to wake up already feeling better. You might have a little discomfort from the cut, but bringing the bone together and making it stable is going to bring that person relief, and most people are happy from minute one that they did the procedure. So after sternal nonunion surgery, in the short term, everybody gets some degree of relief from their symptoms while the bone is pulled together and stabilized. What we're looking for long term is, does the bone knit together permanently? The plates and screws can only hold things together for so long. So I wish I could say that 100% of people unionize, but bones don't listen to our wishes. So only about 95% of people unionize. So that's a pretty good number. But those 5% of people where the bone doesn't unionize, we can go back in again and do it again. And there's some additional things that we can do that aren't done the first time just because they're a little bit more complicated. But in those 5% of cases, we can go back and almost always we can get it to heal that second time. So there is hope for everybody, but it's a very high success rate just starting out at 95%.